Welcome to the concept of health, wellness, and illness. Our exemplars are consumer education, a judgment to health and illness, wellness, illness continuum, health beliefs, individual cultural, physical fitness, exercise, oral health, nutrition, screening, normal sleep and rest patterns, lifestyle choices, and self-management. Our outcomes are identifying historical perspectives on the concepts of health and illness, wellness and disease, define different aspects of health, wellness, and illness, describe health indicators and focus areas incorporated in People 2020, identify evidence-based professional sources for healthcare guidelines, and describe the stages of change when an individual is developing a wellness plan. So what is health? The professional definitions of health are presence or absence of disease, state of being well and using every power the individual possesses to the fullest extent. That was by Florence Nightingale. The WHO states, the World Health Organization states, a state of complete physical and mental social well-being, and not merely the absence of disease or infirmity. Dynamic state of being in which the developmental and behavioral potential of an individual is realized to the fullest extent possible. And that is also the American Nurses Association. Personal definitions are highly individualized, free from symptom, pain, being able to be active in good spirits, developing a personal definition of health, individuals' previous experiences, expectations of self, age, and social-cultural influences. Wellness and well-being. The state of well-being is self-responsibility, the ultimate goal, your dynamic growing process, daily decision-making, whole being of an individual. So that's your wholeness, your well-being. How are you? Components of this wellness, environmental, occupational, intellectual, spiritual, physical, emotional, social. Well-being is a component of health. So that means that your environment, let's say your environment is, you're in a negative environment, that might affect your overall wellness due to that negativity in that environment. Occupational, you might be in a place that's super hot. So physically, you're hot, and then occupationally you're like, oh geez, I don't really want to go to work. It's not really a good place for me because I'm always super hot, or those types of things too. Emotional, this place isn't good for me because the emotional strain is too much. So that's a place of well-being and wellness. Illness and disease. Illness is a highly personal state. Listen to it again. Illness is a highly personal state, a diminished physical, emotional, intellectual, social, developmental, or spiritual functioning. May or may not be related to a disease. Okay, again, listen to that. May or may not be related to a disease. You might just be ill at some point. You might just not be okay. Illness and wellness continuum. Individuals move back and forth day by day, no distinct boundary. Perceptions of others often affect the placement of this on this continuum. Disease is an alteration in body functions, a reduction in capacities, shortening of normal lifespan, affects physical and or emotional status, your mental status, results from many causes, signaled by identified signals. So there are a lot of things that can trigger this. For example, if you lost a limb, or you find out you have cardiac disease or diabetes. Some diseases can be contracted from others, and some are non-communicable. So for example, HIV, corona. So these are all the things that we need to keep in mind when illness and disease. Illness is continued for acute and chronic. So acute is severe symptoms, relatively short duration. Symptoms appear abruptly and subside quickly, may or may not require intervention. Individuals usually return to a normal level of wellness afterwards. A chronic illness would be last for an extended period of time, and that month that is longer or equal to or longer than 6 months. So keep 6 months in your mind frame for chronic disease. Slow onset, often periods of remission and exacerbation. So one of those would be a CHF patient, so a heart patient. They have times when their blood pressures are good, when they're not swelling, but then other times they have an exacerbation. You always hear an exacerbation of COPD. So these are the people that come in, they cannot breathe. A lot of factors that influence this are the weather. When it's real hot outside, it's a lot harder for our asthmatics and for our COPD people to breathe. Health behaviors and illness. Illness behavior, how persons describe or monitors, interpret symptoms, ways of taking remedial action, sick role behavior, uses the healthcare system, may involve dependence, behaviors such as avoiding usual responsibilities, and these are highly individualized. The effects of illness on the patient and the family. There are 4 types of crises that we think about. Remember, we were talking about families and how they handle issues. So there's a chronic illness, a major injury, mental illness, and pediatric illness in specific. These disrupt the family functioning. It brings a bunch of changes. If one of these occurs, it can be behavior or emotional problems can occur. Self-concept and body image are huge in these types of crises. Lifestyles might be changed, loss of autonomy, so they're not able to do things by themselves anymore, or they need help, and often means a total lifestyle change for the entire family. Nurses, what are we going to do to help this? We're going to provide explanations. We need to give good education. Okay, so you cannot just stand up anymore. You're going to need to stop and sit for a minute, and then you can stand up, okay? So you don't have the use of your leg anymore. We're going to show you how to go to the bathroom, and PT's going to come in here, and you and I are going to rock this bathroom road. Making arrangements to accommodate this patient's lifestyle. We're going to help them accommodate, okay? We're going to get services involved. We're going to encourage other healthcare professionals to become more aware of the patient's lifestyle. Hey, this is a big change for them. Maybe they were just diagnosed with diabetes. Hey, they don't know how to stick their finger. Maybe a Libra would be a better idea for this patient to monitor because they're really savvy with their phone. Supporting healthy aspects of lifestyle. Dude, you cannot drink the whole Mountain Dew, okay? We've got to find another alternative that you like. Let's find something that you like. Reinforcing desirable changes and practices. Let's find things that you like and that'll work with your life. All these things that we're doing with our patients is health promotion. Healthy People 2020 help us improve the health of Americans. That's what we're doing, improving the health of Americans. 4 major goals: attain high quality, longer lives free of preventable disease, disability, injury, and premature death. Whoa, that's huge, right? Number 2, achieve health equality, eliminate disparities, and improve the health of all groups. Number 3, create social and physical environments that promote good health for all. Number 4, promote quality of life, health development, and healthy behaviors across the life stages. Health promotion continued. Types of preventative services: primary, secondary, and tertiary. So your primary preventative services focus on that health promotion, illness prevention. The secondary include the diagnosis and treatment of disease. Tertiary seek to restore health after an illness or accident, including rehabilitation and palliative services. Health choices, okay, influenced by health status, beliefs, and behaviors. Remember when we went back to diversity and culture, everything affects everything. So your self-concept rolls down into your culture and diversity, rolls down into your health promotion, rolls down into your health choices. okay, may or may not be under a conscious control. They might not know that they're doing it for that reason. I just like corn because we have always had corn every Friday. I grew up, we had corn every Friday, so I have corn every Friday. Maybe we need to cut the corn out. Do you see what I mean? So that might be an unconscious choice for them. Well, that's just what we do every Friday. Internal variables, genetic factors, mental illness, cognition disorders. Those are, especially our dementia patients and stuff, they might have problems with that kind of stuff. For our MR patients, so mental retardation and our autism spectrum, all of those things. When they link to their health problems, the nurse and patient must work together. Particularly, we really got to work together to find what works for our patients. Health promotion across the lifespan, there's definitely different factors like pregnancy, the mother's age, prenatal care support system, events surrounding the fertilization, so like IVF patients are a little high risk, physical impairments, previous pregnancy experiences. If you've had a miscarriage before, then you're going to be, usually you're placed on high risk, or those types of things are definitely taken into consideration. Cultural and ethnic factors are also taken into consideration. Childhood obesity can lead to long-term health problems, high blood pressure, cholesterol, sleep apnea, asthma, and things that we would normally see in older adults, and they're happening to children. Definitely affected by eating habits and exercise patterns, and can affect the psychological stress of the child. Factors in older adults, increasing physical limitations. People don't like to get old. I want to be able to do the things I want to do. And this is a lifestyle fact that we have to help them with. It doesn't have to be that way, but we have to help them maintain and promote their wellness and their health. Chronic illnesses, change in cognitive status. No one likes to have their driver's license taken away from them, so we have to keep that in mind. Difficulty accessing health care. Inadequate support systems. Some people don't have people at home. Need for environmental modifications like ramps and no throw rugs. Attitudes of hopelessness and depression. You see a lot of drinking in older adults and taking medications to numb. Awareness of mind and body interactions. They can increase susceptibility to organic diseases and alterations in immune system. So your mind really does control your body. Your mind's ability is directly related to your body's functioning. Physical exercise. So there is physical activity, body movement, and produced by skeletal muscular contraction and increased energy expenditure. Then there's exercise, planned, structured, repetitive, purposeful body movements, performed to improve, maintain fitness. Activity tolerance is the type or amount of exercise. ADLs, so that's your activities of daily living. Individuals can perform with or without adverse effects. And functional strength, body ability to perform work. Types of exercise, there's isometric exercises, static or setting exercises, strengthening, they're maintaining strength with immobilized muscles, endurance training. The isokinetic are resistive training, isotonic, or it can be isotonic or isometric. Machines and different devices build up certain muscle groups. Aerobic is the amount of oxygen taken in by the body greater than the amount that used to perform the activity. Target, heart rate, talk test. Anaerobic muscles cannot draw enough oxygen from the bloodstream, and anaerobic pathways used for additional energy. The effects of exercise on the mind and body, guys. Cognitive function. Physical exercise may induce cells to the brain to strengthen, and build neuronal connections. Exercise may have positive effects with individuals with Parkinson's disease and Alzheimer's, and some research questions these findings. Musculoskeletal system, it stops the breakdown of your muscles. Joints receive nourishment, bone density strengthens, improves stability. Cardiovascular system, it helps to prevent strokes, increases heart rate, strengthens the heart, mediates harmful effects of stress. Yoga may help improve cardiovascular health as well. Respiratory system, ventilation, oxygen intake and increase, eliminates the toxins with deeper breaths. Problem solving, emotional stability, it helps everything, guys. Prevents pulling of secretions and decreasing breath. Do you ever go for a walk or a run and have a big cough that you needed to come up afterwards? Well, that's where it comes from. Yogatic breathing, postures may benefit individuals with asthma. Improves appetite, increases the GI tract tone, and abdominal compression exercise and yoga postures improve the symptoms of irritable bowel. The effects of exercise continued. First, we have the metabolic and endocrine system. Changes in the metabolic and endocrine system include elevation of the metabolism, weight loss, and exercise, stability of blood sugar. These are all sounding good things, right? The elimination system, it promotes efficient blood flow to the urination system. The body excretes waste more efficiently. The immune system, lymph fluid pumps more efficiently, circulation improves. Moderate exercise enhances immunity. Strenuous exercise may strenuous exercise may reduce immune function. So if you exercise too much, that actually might be detrimental to you. Adequate rest after vigorous exercise is important for allowing the body to recover. So you have to have a good recovery system as well. Psychoneurologic system. So the mental effect on that exercise has on it, it affects many of disorders and may affect the desire to move. Fatigue or chronic stress discourages exercise. Exercise has more positive effect on depression than relaxation and meditation. Placebo, not more effective than medication. Psychologic therapy and the combination. Regular exercise improves the quality of your sleep, and the lifespan considerations recommendations change by age group and weather conditions. So that means that you want to look at your age groups. So how much exercise is a child going to need? How much exercise is a teenager going to need? How much exercise is an adult need? And there's some really nice tables in your book that I'd like for you to get familiar with so that you can know the ins and outs of all of those. So what do nurses do in this time? How do we as nursing manage these patients and manage exercise? We're going to model healthy exercises and attitudes and behaviors. We're going to facilitate patient involvement in the setting and actively participating in their goals. So for example, we're going to have someone say, okay, I really don't like biking, so what's something else that I could do? So maybe they're walkers, maybe they like to rollerblade or skate, maybe they like to do kayaking, those types of things. We can also incorporate those things into their lifestyle, or things that they might want to do as a goal. Teach patients self-care strategies. We're going to teach them things to enhance their fitness, to help deal with possible aches and pains. Hey, I had a knee replacement. How do I exercise? Well, we might not be able to run, but maybe biking would be better for you, or maybe some other type of exercise would be better for you, walking instead of jogging. We use visual aids to show how to stretch, so we can hand out the pamphlets and things that help with visual aids in order to teach people how to properly stretch and properly do exercises. Oral health. Some of the things that we're going to go over with oral health are the normal and the alterations. So normal appearance of the teeth, they appear between 5 and 8 months after birth, and all 20 deciduous teeth by the ages of 2. So children start losing the deciduous teeth at age 7 or 8. And they gradually are replaced by the 32 permanent teeth by age 25. So tooth enamel usually wears away over time, and 30% of the population loses their natural teeth by age 74. Alterations are dental caries, periodontal disease associated with plaque and tartar and deposits. The piece that we want to assess with your oral health are your lips, your gums, your actual teeth, the bone structure and the rigidity of the bone, the cheeks and mucosa. Some lifespan considerations for oral care. Oral care for infants and toddlers is a little bit different than older children. Dental hygiene should be done each time after feeding and should begin with the first tooth eruption. Dental caries frequently in toddlers are due to excessive sweets or bottle feeding during naps or at bedtime, so they fall asleep with that bottle. Brushing begins at 18 months. Fluoride supplements and first dental visit at 6 months. Oral health for preschoolers and school-age children. Dental care is essential in the deciduous teeth in order to keep good repair, establish good dental habits. Fluoride is important for these kids and for this age. Preschoolers can be taught how to brush their own teeth. Regular dental checkups are also recommended. Oral health for adolescents and adults. It really includes your diet as well. Proper diet and tooth and mouth care should be reinforced. Brushing morning, noon, and night. Usually after meals is really where we're catching this. Make smokers aware of risk of losing teeth because the gums recede when you're a smoker. Oral health is super important for pregnant women. The effects of hormone changes and mineral deposits and depletions of your minerals can also affect your teeth during pregnancy. Gingivitis is also seen a lot. Increased saliva or decreased saliva during pregnancy can cause problems, and granulomas on your gums. So those are things that you see during pregnancy. So gastric acid from morning sickness can also cause this problem. So your patients that have gastric reflux, you do want to keep a close eye on their teeth because the acid can wear away their teeth. Increased incidence of periodontal disease during pregnancy, more bleeding from gingival silicus. So that's like your gums are swollen as well. Oral health for older adults, they're at risk for more cavities, periodontal disease. The effect of lack of fluorinated water and preventive dentistry during the developmental years may cause problems throughout their lifespan. Oral care might be difficult due to dexterity problems and dementia. So people forget to brush their teeth or aren't actually brushing them properly. Xeromas are common, and they should drink more water. So they're super thirsty, dry mouth, and they need to drink more water. Sleep, wonderful sleep. There are different stages of sleep. There's non-REM sleep, which is their stage 1, very light sleep, lasts a few minutes. Then there's stage 2, which is light sleep, and that's 50% of all of your sleep is in this stage 2, which is a light sleep. Stages 3 and 4 are deep sleep. So sleeper is very difficult to arouse, eyes don't move, muscle activity stops. And then your circadian rhythms, biological rhythms, and controlled within the body. Your circadian rhythms are controlled in the body, synchronized with environmental factors, light and darkness. That's why we usually sleep better at night, because your body needs that sleep and light and dark cycle. Sleep and wake cycle is best known as the circadian rhythm. Awake when the body temperature is highest, asleep when the body temperature is lowest. And we begin to develop that in 6th week of life. Lifespan considerations for sleep. Sleep in infants, they wake up every 3 to 4 hours, which you just knew that because, up to 6 weeks, we're not even getting into a rhythm, right? So we started getting into your circadian rhythm at 6 weeks, so we still are needing some time. Periods of wakefulness and increase, sleep throughout the night, at times daytime naps by 6 months. Half of the time is in light sleep, active sleep during light sleep. Putting to bed when they're sleepy but not asleep helps infants become self-soothers. Sleep in toddlers. They need an afternoon nap. Decreasing need for morning nap may resist going to bed. We wouldn't know that, right? Nighttime fears. Nightmares are common. Mommy, there's monsters. Those types of things. Security object can help. So a teddy bear, a blanket. Consistent bedtime routine helps. Sleep schedule promotes good sleep habits. Sleep and preschoolers. The need fluctuates in relation to activity and growth. They dislike bedtime and may resist. Restlessness, irritable if they don't get enough sleep. Maintain consistent sleep schedule. It helps. Relaxing bedtime routine will also help this. Wake frequently at night, may fear the dark or have night terrors or nightmares. Limiting or eliminating the TV can help. Sleep and school-age children, most get less than their optimal sleep. Demands of homework, sports, social activities, spend more time at the computer and the TV, and they also drink caffeinated beverages. Consistent sleep schedule will again help this. Getting them into a routine. Routine always helps, and routine helps our adults too. This is our consumer education. So what does consumer education mean? Consumer education is our education that we're giving our patients or our clients. It should be evidence-based. It is patient or client-driven. It's delivered in preferred learning style. So that means if they are a hands-on learner, we want to do hands-on things with them. If they learn by pictures, we need to do pictures with them and not under distress. When the patient is having an anxiety attack, it's not the time to teach them what they should be doing. We have to address the issue and help them through that process, and then we're able to more likely educate them on how to stop these things. So that's especially like even with sleep. You try to tell a toddler when they're having a tantrum, you didn't sleep well last night. It's not going to work. They're not hearing you. It's the same with our adults. When we're under distress, we're not listening. We can't absorb those things because our body has gone to a different psychological level. Remember when we talked about Erickson's, right? We've kind of downgraded again, right? So we need to make sure that our consumer education is on point so that we can give them the proper education and not under distress. Thank you for listening. Have a great day.